Contact the hospital blood bank in advance. Prepare for a major hemorrhage.
Major hemorrhage.
Not good. The oxygen saturation in the mother's blood is rapidly decreasing. Her blood pressure is also dropping, and it severely contradicts the amount of bleeding. Symptoms of hematuria are appearing.
Calm down. Observe the pregnant woman's condition carefully. The pregnant woman is having difficulty breathing and is accompanied by convulsions.
The pregnant woman has completely lost consciousness.
Amniotic fluid embolism. The sign. What should I do?
We absolutely
Director Han. This surgery. We cannot do it.
Who says we can't? With me here. She will definitely be safe. This surgery. I will perform it.
Something goes wrong. How will you explain it? Let's go.
Prepare to begin the rescue.
Everyone, cooperate with Linfeng. Linfeng will be the lens surgeon. Others assist.
It's been a minute and a half since the pregnant woman was found to have amniotic fluid embolism. There are only about 3 minutes left.
Time check.
Badging time 11:23.
Han Qingya, First Assistant Li Yun, Second Assistant, Xiaosun. 3-minute countdown.
Okay.
From now on. This surgery will be led by me.
The golden time is only 5 minutes. Now there's less than 3 minutes of golden time. Linfeng wants to complete the surgery within 3 minutes. Who does he think he is? A miracle doctor.
Perhaps. He really is a miracle doctor. No, that's wrong. How could a miracle doctor be in a small hospital?
The Lasker International Medical Conference.
Jiangxi is top surgical expert. Young genius Linfeng
The Lasker Medical
successfully won the highest medical honor, the Lasker Award. The award ceremony will be held at the International Auditorium in Sweden.
Lasker International Medical Research Award Ceremony.
Let's look forward to Linfeng's appearance.
Divine Dr. Lin. The award ceremony is about to begin. You need to prepare to enter. Divine Dr. Lin. Divine Dr. Lin is missing. Breaking news. Divine Dr. Lin Fang has disappeared without a trace. Our reporters will continue to report. Assistants searched for many days to no avail. Where exactly did the Divine Doctor go? The Divine Doctor disappeared after reaching the pinnacle of his life. His fate remains a mystery.
The Divine Doctor disappeared.
Director Han.
Linfeng.
What are you looking at? I've caught you several times now. Every time Director Han passes by here, you always sneak a few glances. You a mere nursing assistant couldn't possibly be interested in Director Han, could you? You really are a toad lusting after a swan's flesh. Director Han is the hospital dean's daughter. Is it something you could like? Your job as a nursing assistant was given to you by Director Han out of kindness? Otherwise, with your associate's degree. How could you get into our hospital? Director Han's idol is the unparalleled doctor, Divine Dr. Linfeng, who has saved countless lives. She wouldn't even look at someone like you, a nursing assistant who can't even enter the operating room.
Quick, move aside, quick. Contact the blood bank.
Okay.
Prepare for CPR procedure.
Zhao Jiang, prepare the automated external defibrillator. Zhao Li, establish for access. Prepare epinephrine.
Automated external defibrillator is in position. Analyzing heart rate. Continuous chest compressions.
Go quick.
Linfeng, Director Han is calling for you. Come with me quickly. Director Han wants to see Linfeng, a nursing assistant. How is that possible? The granddaughter of the richest man, Song Zheng, was in a car accident. She's already been transferred to 6 hospitals. Her injuries are severe. The situation is critical. Now, someone is urgently needed. To assist Director Han, the richest man's granddaughter has already been transferred to 6 hospitals. Linfeng, a mere nursing assistant, to assist Director Han. Can he do it? It's only because the emergency department has no one available. Linfeng's hemostasis technique is excellent. That's why Director Han called for him. Linfeng, no time to dawdle. Come with me quickly. Linfeng's hemostasis technique is excellent? How is that possible? This was just bandaged by Linfeng.
The operating room.
Director Han, I've brought Linfeng here.
Isn't this the one Qingya introduced to the hospital, that stinky orderly? Qingya, did you call the wrong person? Why did you call an orderly here? What help can he be?
Although Lin Feng is an orderly, he is the best person I've seen at stopping bleeding.
The best at stopping bleeding.
This is bad, Director Han. The patient's blood pressure is dropping.
Lin Feng, you first help Deputy Director Li press on the wound.
Okay.
No need. What does an orderly know? He'll only get in the way. It's better if I do it myself.
Wait a moment. Your technique is wrong.
I am an attending physician. The illnesses I've treated are more than all the patients you've seen. I am saving her life.
If the patient were an adult, what you're doing would indeed be correct, but the patient is a child. If you press this area, it will compress her trachea. If you keep pressing, you'll suffocate her.
Tracheal respiration.
Breathing has resumed. Blood pressure has also recovered.
Lin Feng, prepare to perform surgery with us.
Lin Feng, you're just an orderly who came to help. Mind your place. In the operating room, everything must follow the lead surgeon's orders. You have no right to make decisions on your own.
The patient has fractured ribs and multiple glass fragments inside their body. To avoid secondary injury,
It's cut.
When removing the glass, the wound must be pulled open before the forceps can be inserted.
It's pulled open. Time to remove the glass.
Forceps.
how is Lin Feng so familiar with the surgical procedures? Could it be that he can perform surgery?
Film was translated and narrated by M.
Sun shaking. Put her on a ventilator.
Yes.
The patient has lost too much blood. Put her on a ventilator. Prepare for a rapid blood transfusion.
Yes.
It's all because you didn't follow orders and operated blindly, which led to the patient's critical condition. Hurry and save her. What are you doing?
The patient's excessive blood loss is due to increased intrapleural pressure, leading to venous dilation. We must operate immediately to drain the gas from the cavity.
Nonsense. Why didn't I see that? The patient's intrapleural pressure is increasing. Besides, even if there really was a problem, it should be handled by us, proper doctors. How could it be your turn, a mere orderly, to perform surgery?
Director Han, the patient's heart is about to stop.
The patient's pleural cavity pressure is increasing. Prepare for surgery quickly.
Han Sanquin, my granddaughter has already been transferred to 6 hospitals. Your hospital is my last hope. If you can't save my granddaughter,
Han Sanquin.
then you, as a dean, shouldn't continue.
Elder Mr. Saul, don't worry, my daughter is a professional emergency physician. She will definitely ensure your granddaughter is out of life-threatening danger.
This is bad. The patient is starting to convulse.
Is this the professional emergency physician you spoke of? Who can guarantee my granddaughter will be out of danger?
Han Sanquin,
Zhao Ocean.
to boost your daughter's resume. You disregard the lives of other patients. Are you still fit to be the hospital dean? J. Ocean, what are you doing here as the vice dean of Renai Hospital? Of course, I'm here to treat patients. Han Sanquin, for your daughter to smoothly take over the hospital. You disregard the lives of other patients. Aren't you being too selfish? What do you mean by that? I have no selfish motives. It's just that the situation is urgent. Kinja is capable of performing the surgery, which is why I let her be the lead surgeon. The situation is critical now. Are you sure your daughter has this capability? You, stop arguing for now. The child's injuries are most important right now.
Zhang Ziming.
Let me assess the situation first. They are actually operating on the patient in this kind of environment. In this situation, besides Divine Dr. Lin, no one has ever succeeded.
Dean Zhang, as the dean of the International Medical Research Institute, you must know Divine Dr.
The
Lin.
film was
Could I trouble you too?
translated and
Ask him to
narrated
save
by
my
M.
granddaughter?
Media.
I only had a brief encounter with Divine Dr. Lin at his award ceremony. I only had a brief encounter with him. If Divine Dr. Lin were to appear, I would definitely recognize him. It's just a pity that he has already disappeared.
Blood pressure is rising. Blood oxygen 92. Respiration has recovered. Pleural cavity pressure has also recovered.
Prepare to finish up. Monitor the intrathoracic pressure index. Lin Feng, come out with me for a moment.
The operating room.
Lin Feng, have you performed surgery before?
Yes, I have.
You performed well today. I plan to promote you. How about becoming my assistant?
No way! He's just a small orderly. Even if he's to be promoted, he shouldn't be promoted to the position of director's assistant, right? If you do this, aren't you afraid of causing dissatisfaction among others?
An orderly can be promoted to director's assistant. Acting so carelessly. Dean Han, is your daughter truly capable enough?
Dad, my decision to let Lin Feng be my assistant is not groundless. I believe he has the capability.
Capable? He's just an orderly. A handyman. Mr. Song. He can even be promoted to chief assistant? It shows that Director Han's capability is also just average.
Director Han, you actually let an orderly be your assistant. This clearly shows you don't care about my granddaughter's safety. Fortunately, Yin Yan is fine this time. If anything happened to Yin Yan, I would definitely hold you accountable.
Director Han, I just observed that the patient's electrocardiogram shows some abnormalities. An ultrasound examination is needed.
Mr. Song, don't listen to his nonsense. Your daughter's
the film
heart,
was translated
its physical
and
characteristics
narrated
are completely
by
normal.
Media.
There's no need for an examination.
Your name is Lin Feng, right? Why did you just curse my granddaughter?
I didn't curse her. I was just stating facts.
Still dare to quibble? Someone, take him away.
Mr. Song, no matter how anxious you are, you'll have to wait until the test results are out. How about we give the patient an ultrasound examination? If there's an issue, we can intervene promptly. If there's no issue, it won't affect you either. Don't you agree?
Director Han, I've been practicing medicine for so many years. Could I possibly be inferior to an orderly?
Exactly. Junior sister. Jay Ocean is the top expert in our hospital's field. Rather than listening to a small orderly. Waste time here. It's better to listen to Jay Ocean.
The patient's heart rhythm is consistent, but the amplitude has decreased. Her heart must have a problem.
Lin Feng, you're just an orderly. Allowing you into the operating room is already a great honor. And you're still here making irresponsible remarks. Someone, drag him out.
I'd like to see who dares. Jiaoshen, doing one more examination is a safeguard for the patient. Why are you so quick to judge Lin Feng as wrong? Or are you afraid that you yourself are wrong? Afraid of losing face?
Afraid of losing face, Director Han? I've come all the way to this position today. Have I never made a mistake? What's there to be afraid of losing face for? I just don't want to lower myself and argue with an orderly. If you want to do the examination, fine. But if the examination shows no problems, what then?
If there are no problems, I am willing to resign and leave.
Kinjia. All right. With Elder Mr. Song here as a witness. If you lose, don't say I'm bullying a junior. Kinjia, you're too aggressive.
Dad, I trust Lin Feng. Li Yun, go to the operating room and check.
The film was translated and narrated by Media.
Once I send Song Kinjia out of the hospital, who else can contend with me for Han Sangquan's position? Hey! You are.
How is it?
The ultrasound results show everything is normal.
Ultrasound results.
How could this be? Could it be that I really misjudged?
Director Han. Shouldn't you voluntarily resign? Kinjia, you say you. Why bother?
It's all your fault. If it weren't for you, junior sister wouldn't have to resign voluntarily. Linfeng, do you know what she gave up for you? How important it was? My junior sister spent the past 20 years devoting herself to the medical profession. She swore to become someone like divine Dr. Lin. But because of you, not only is her beloved career gone, but her future is gone too.
Enough, senior brother. My career and future are not that important. As long as the patient is healthy, that's all that matters.
Is what you're doing really worth it?
Diagnosis result.
Prepare for emergency surgery.
Enough! Linfeng, at a time like this, are you still bragging?
Linfeng, you must be crazy to want to climb the ranks so badly. The test results are clearly right here. Are you saying you're better than the machine?
I disagree. Ocean, your hospital allows a nursing aide to act recklessly. My Song family cannot afford this. I'm taking Yin Yan to another hospital.
Old Master Song, if you don't want your granddaughter to have an accident, I advise you to listen to me.
You.
This is bad. The patient suddenly has organ failure. The situation is critical.
The test results just came out. How could there suddenly be organ failure?
Prepare for surgery.
So fast.
You can't. This.
What exactly is going on? Didn't you say my granddaughter had already escaped danger? How could she suddenly have organ failure again?
I don't know either right now.
From now on, I will be the lead surgeon for this operation. Director Han, Deputy Director Lee, you will assist me. Nurse Sun, you are responsible for handing instruments.
Linfeng, you just happened to guess right once. Don't be so arrogant. I'm telling you, the operating room is not a place for you to fool around. You are not qualified to be the lead surgeon. Get out of my way.
If I step aside, can you cure her?
Even if I can't, there's still Kinjia here. It's not your turn to be the lead surgeon.
I don't know how to treat it either. Perhaps this surgery can only be completed by Linfeng because his predictions, several times, have all been correct.
Junior sister, maybe he just got lucky and guessed right.
We trusted the machines too much before, but in the current situation, machines cannot detect it. But Linfeng discovered it. Linfeng, I'm willing to trust you one more time. Cooperate fully.
Forceps, right angle clamp, blood transfusion. Blood oxygen saturation.
56, 57, 58.
I didn't misjudge him. Linfeng truly has ability.
Linfeng, you'd better perform the surgery well. If you implicate Kinjia, I won't let you off even if it costs me my life.
That kid really does have some skill. He could actually spot the problem. But even if he spotted it, what then? Spotting the problem doesn't mean he can save the person. Once you've caused the richest man's granddaughter's death,
The film was translated
dean's position will
and
still be mine.
narrated by M Media.
Ocean, can they really save my granddaughter? Speak up. Will my granddaughter be alright?
Difficult. It's difficult. Richest man's song. That kid is just an orderly. Even if he got incredibly lucky and guessed your granddaughter's illness correctly, he absolutely cannot be the lead surgeon for this operation. Your granddaughter's life cannot be saved.
Why? Aren't you the vice dean? Make them get out. You go perform the surgery and save her.
Elder Mr. Song, you don't know. For heart failure, the golden treatment window is very short. Now the time has already been delayed by him. I am also powerless to reverse the situation.
Dean Zhang, is there really no other way?
Indeed, as Vice Dean Zhao said. Moreover, for this kind of heart surgery, except for divine Dr. Lin, I haven't seen anyone else succeed. Given your granddaughter's current condition, I'm afraid the outlook is grim. Elder Song. If you want to blame someone, blame Director Han and that young orderly for trying hard to show off in front of you and wasting time.
How could this happen? Could it be that my granddaughter is destined to die here today?
Han Kinja, this is all you're doing. If you hadn't insisted on having your own way, would the patient not have survived? Golan, have you recorded everything? Doctors with such poor character and corrupt medical ethics must be exposed. We absolutely cannot let such scum affect our hospital's reputation.
Vice Dean Zhao, rest assured. As the head of the hospital's publicity department, I've already, through surveillance, recorded the entire surgery. I can expose them at any time.
Good.
The surgery was successful.
What did you say? Did the surgery succeed?
Could that orderly really be able to perform surgery? Kinji's persistence was correct.
Yes, the surgery was a complete success. Medical staff can go in to check later. However, the patient just finished surgery and is quite weak. So please be quiet later. Don't disturb the patient's rest.
Really?
This is absolutely impossible. In just half an hour's time. How could the surgery be completed? The patient must have died on the operating table. Isn't that right?
Vice Dean Zhao, what do you mean? Could it be that you're hoping something bad happens to my granddaughter in there?
Elder Song. As the Vice Dean of Renai Hospital, the Chairman of Jiangking Medical Association, and even a provisional member of the third phase of the Worldwide Medical Association, I've treated more patients than you've ever seen. Don't you believe my professional judgment?
Dean Han, what do you say?
I believe my daughter wouldn't lie to me. Such baseless opinions should not waste everyone's time. Oh my god. I understand now. You let us in so you can pin the blame for the failed surgery on us, thereby absolving yourselves.
I said the surgery did not fail.
Lin Feng is right. We cured your granddaughter.
Kinjia, the situation in the operating room at that time, we all saw it with our own eyes. Organ failure. Even immortals would find it hard to cure.
What if I saved her then?
It's him. It's him. I didn't expect that. I would actually find his trace. No. I must quickly go back and prepare a generous gift. Lin Feng, I believe you have good intentions. But the current situation is this. If there were even a glimmer of possibility, I would be willing to believe you. But the facts are laid out here. The dead cannot be resurrected.
Dad, don't you believe us either?
Believe you? I'd rather believe there are ghosts in the world. You two conspire together to shift the responsibility for the medical accident onto us. You are simply not fit to be doctors.
You quacks. How could you be so malicious? My granddaughter is already like this, and you still want to exploit her? I will make you pay the price.
The operating room is right here. You'll know if she was saved or not with one look.
Elder Song, please don't be deceived by this orderly. They claim they can save people? How could they possibly have the ability to save people? An orderly, a young man, a deputy director. They don't even count as half a professor. Save people? What gives them the right?
Exactly, especially that Lin Feng. He's clearly just an orderly who just started not long ago. How dare he overestimate himself and perform surgery? Is he worthy? If you ask me, they should all be arrested. They are the ones who killed Elder Song's precious granddaughter. They must be held responsible.
Arrest all of them.
Grandpa!
Why do I hear Union's voice? Is it an auditory hallucination?
Elder Song, you don't need to intervene in this matter. Our hospital's affairs, we will resolve them ourselves. Guards, arrest these quack doctors. Now, we can get Lin Feng and Han Kinjie kicked out of the hospital.
Elder Song, you've been misled by Jaeocean. Although Lin Feng is just a humble orderly, it's thanks to him today that your granddaughter was saved.
Elder Song, just go in and take a look. You'll see. Your little granddaughter is really fine now.
I think you all just want to sneak away while we go inside. Don't you? Guards, arrest them.
Elder Song, are you sure? You still want to stand here and listen to his nonsense?
What do you mean?
Just go in and see for yourself.
Grandpa, where are you? Where is this place?
See, this doctor cured Yin Yan. It seems I misunderstood. That orderly named Lin. When we go out later, we must properly repay him.
Elder Song, this is absolutely impossible. The child's organs were clearly failing. In such a short golden window of time, how could a mere orderly possibly save her? This is impossible.
Why is it impossible? Lin Feng's ability is something we've all witnessed. If it weren't for him, we would have had no ability whatsoever to pull Miss Song back from the brink of death.
No, this is impossible. He just got lucky, like a blind cat catching a dead mouse. It was Miss Song's own good luck. It had nothing to do with Lin Feng.
Vice Dean Zhao, do you think my brain is filled with water? That phrase bad luck, you actually dare to say it. Move aside. Mr. Lin, I sincerely apologize to you. Just now, I listened to slanderous words and wrongly accused you. I never expected you truly had the ability to save my granddaughter.
It's nothing. Just part of my job.
All right, young brother. If you have any requests, just state them. I will definitely repay you with all my might.
No need. I didn't do it to seek your reward. When I saved Miss Song, I just didn't want to see such a vibrant life perish before my eyes.
Did you hear that? It's a benevolent heart of a healer.
Whether it's a benevolent heart of a healer, let's not discuss that for now. Now, Miss Song's condition is basically stable. However, she still needs a long period of rest and recuperation. Therefore, I hope you, Elder Song, can spend more time and accompany her more. Also, prepare more nourishing medicinal meals for her to replenish her body.
Yes. Mr. Lin is absolutely right. I'm extremely grateful.
No need to thank me. It's truly my duty. I'll be leaving now.
Hey, Mr. Lin, please wait. This is my business card. Take this business card to the Song family.
The film was
And the Song
translated
family will not
and
object.
narrated by
All
M.
enterprises under my Song family, upon seeing this business card, will treat it as if they are seeing me in person. Mr. Lin, please, you must accept it.
This is Elder Song's private business card.
I heard Elder Song's business card on the black market has been speculated to a price of 600 million, and it's priceless but unavailable. Lin Feng, Elder Song is actually giving you his business card.
This business card, why wasn't it given to me? If I had this business card, any hospital nationwide, the position of dean, I could choose freely.
The film was
Lin
translated
Feng.
and narrated by M.
Lin
Media.
Feng, wait for me. Today, I knew you would be fine. If it weren't for someone obstructing us, we would have saved Miss Union long ago. Fortunately, Elder Song did not listen to Vice Dean Zhao's slander.
Since the outcome is good, then, regarding your previous defiance towards me, I won't hold it against you. You should have just said you were this capable earlier.
Stubborn as a mule. If Lin Feng hadn't been here this time, we would have been dealt with long ago.
At least the outcome is good, right? We have successfully saved another patient.
Kinjia. This time, it was Dad's fault. I shouldn't have wrongly blamed you.
Dad, the person you should apologize to isn't me, it's Lin Feng. He withstood the pressure from Elder Song to save the patient. Otherwise, our hospital's reputation would have been ruined long ago.
Lin Feng. This time. Thank you very much.
You are too kind, Dean. This is my duty. Since the surgery is over, let's all disperse. Don't let us affect others using the operating room later.
Okay.
All right.
How could this be? Lin Feng is just a small-time orderly. How could he seize such a short rescue window? Even when I perform this kind of surgery, there's a significant risk. Why? How can he be so nonchalant? Why? Just Lin Feng can put the patient's safety first. In your eyes, there's only profit. You don't deserve to be a doctor at all. I don't deserve it. My medical skills have been evaluated by national experts and tested by tens of thousands of patients. Lin Feng is just a small nursing assistant who just got lucky. He simply can't compare to my medical skills.
You want to know if I just got lucky? You can see for yourself later by watching the operating room playback. After all, you are also a doctor.
You.
Lin Feng, you still haven't answered my question. Who exactly are you?
What kind of person could I be? I'm just an ordinary person who's a bit luckier and knows a little about medicine. That's all.
I don't believe it. If you were an ordinary person, how could you possibly?
Wife, please don't scare me. Wife.
Lin Luigi. Julia.
Please, everyone. Can someone save my wife?
Pregnant woman, premature labor, contact the hospital, mobilize personnel and equipment.
Okay.
This method of faking an accident for compensation nowadays is really elaborate. Even pregnant women are involved now. Yes, buddy. I wouldn't dare help. What if you accuse me of extortion? I'd lose everything, even my underwear. No. I'm not trying to extort you. Please save my wife.
I know. I believe you. Please calm down first. Listen to me. I am a doctor. Now, you need to do two things. First, find clean clothes. The more, the better. Second, find something to block the view. Hurry. Come here. Leave this to me.
Do you have clean clothes? Can you lend them to me? I have clean clothes. Can I borrow them? Can I?
The film
I have
was
money.
translated
I have money to
and
buy them.
narrated
Can you
by
afford it?
Media.
This piece of clothing I have. You could work for a year. I beg you. Please help me. Save my wife. I'll be your ox and horse. I'll be grateful to you. Please.
Uncle. Is this okay?
Quick, move aside, move aside. You big strong men. Don't even have as much courage as a little girl. Aren't you ashamed? Hey, I have clothes here. Quickly put it down.
Thank you.
The ground is dirty. Don't let your wife get hurt. Hurry. I also have a piece of clothing here.
Thank you. Thank you.
Come. We need to perform preliminary first aid now. Who has something to block the view? A coat, an umbrella. Any clothes will do.
Hey, I have an umbrella here. I have two. I have one. I have one.
Come. Line up in front of me. Come. Open your umbrellas.
The hospital has been contacted. They'll be here soon. What's the situation now?
The pregnant woman's abdomen suffered an external impact. The fetus was stimulated, and it's likely she had a premature birth.
That's serious.
Hey, everyone, make way, make way. Quickly get the patient into the ambulance. The operating room is ready.
Wait a moment. It's too late to go to the hospital now. Immediately find a suitable location to serve as a temporary operating room.
The patient's condition is so critical now. Why aren't we sending her to the hospital?
Systolic 90, diastolic 50. The pregnant woman's blood pressure is too low. The situation is very dangerous.
Lin Feng, are you going to deliver the baby for the pregnant woman outside the hospital?
The pregnant woman's condition is not optimistic. She won't make it to the hospital. We can only deliver the baby here.
Understood. We will set up a temporary operating room on site. Everyone, please make way.
Hey, doctor, we have tents at our construction site.
That's great. Quick, get ready.
Kinjia, obstetric surgery is no joke. Even a slight oversight can result in 2 lives lost. Look at this environment. Neither the medical procedures nor the sterile environment meet standards. Operating rashly will lead to medical accidents.
No need to say more. I trust Linfeng. Linfeng, I'm counting on you this time.
Hello, friends. We are now conducting a highly dangerous outdoor delivery procedure. The people involved in the surgery include 2 chief physicians from our hospital and Lin Feng, the nursing assistant from last time. Let us wish that the pregnant woman and her child are safe and sound.
What's going on? Director Han is actually bringing a nursing assistant to deliver a baby for someone else. This Director Han, what is she thinking?
Letting a nursing assistant participate in an obstetrics and gynecology surgery. Isn't this a joke? What if someone gets killed?
What's wrong, Linfeng? Have you found a problem?
Difficult labor.
Difficult labor.
Difficult labor. Doctor, I beg you. You must save my wife.
Don't worry, everything will be fine. Give a hand. Quick.
Quick.
Come on. Slow down a bit. Come on. 3, 2, 1. Together. Slow down. Slow down.
Why?
Linfeng, what difficult labor? What nonsense are you talking?
What's wrong with this nursing assistant? He just came up and cursed the pregnant woman with difficult labor. This is truly bad luck. If this jinx's words come true, and something happens to the patient, none of them will escape.
Can we kick this guy out? And then send the pregnant woman to the hospital. Lin Feng is merely making a judgment, based on the actual situation. Moreover, from here to the hospital, there's still a long distance. If a problem occurs en route, there won't be enough time for surgical treatment.
Kinjia, we should quickly take the pregnant woman to the hospital. Perhaps there's still time.
From the moment the pregnant woman was discovered, he became a participant in this surgery. He has the right to speak.
But the pregnant woman's condition is still relatively optimistic. There hasn't been any sign of difficult labor.
This is bad, Director Lee. The pregnant woman's contractions have stopped.
What?
You, get out of the way. Go.
Contact the hospital blood bank in advance. Prepare for a major hemorrhage.
Major hemorrhage. I'll contact the blood bank.
You, Lin? Shut your jinxing mouth. If anything really happens to the pregnant woman, I'm not done with you.
What are you doing? Who allowed you to perform surgery? Have they paid their registration fee? Have the consultation fees
The
and medical
film was
expenses been paid?
translated
No
and
payment.
narrated by
You're all
M
busy
Media.
here. Performing surgery here. Do you have any regard for the hospital's rules and regulations? In your eyes?
Vice Dean Zhao. Extraordinary times call for extraordinary measures. What's most important now isn't payment. It's saving lives.
You're just a small nurse aide. You have no right to speak.
The pregnant woman is having a difficult labor now. It's extremely critical. She needs emergency treatment. They can pay after the treatment is done.
Nonsense. They don't understand. But don't you understand? They haven't paid. How is the hospital supposed to make money? The cost of medical equipment consumed during the surgery. Who will bear that? Doctor, I have money. Please, save my wife first. I will definitely pay. Definitely pay. Get lost. Why are you giving me money? If you want to pay, go pay at the hospital front desk. My wife is having a difficult labor. She's going to die. Whether your wife lives or dies, what does that have to do with our vice dean? You must follow the rules and regulations, understand? Who hit me? You bunch of unruly commoners who can't even afford surgery fees. Believe it or not, I'll call the police and have you arrested. Who said he doesn't have the surgery fee? Brother Zhao. Zhao Li, why are you all here? We heard something happened to your wife. So we brothers rushed over. I have 20,000 here. Take it. It's not enough. I'll go get more. Here's 15,000. Take it. Brother, I have 5,000 here. Just take it. Thank you. Thank you all. Now, can you perform the surgery for old Zhao's wife? This little money you've scraped together. It's not even enough for my travel expenses, let alone with so many people here now. Are you trying to kill my wife? What are you trying to do? Do you want to hit someone?
Vice Dean Zhao, For this surgery now, the most important thing is the pregnant woman's safety. They all have money now. Let's quickly perform the surgery, shall we?
Okay, since that's the case, I'll reluctantly take a look. Unrelated personnel. Everyone out.
Hey. He can't perform this surgery. Prepare to take over. During the surgery, don't point it at the pregnant woman.
Okay.
Not good. The oxygen saturation in the mother's blood is rapidly decreasing. Her blood pressure is also dropping, and it severely contradicts the amount of bleeding. Symptoms of hematuria are appearing.
Calm down. Observe the pregnant woman's condition carefully. The pregnant woman is having difficulty breathing and is accompanied by convulsions.
Hello. Can you hear me? Oh no. The pregnant woman has completely lost consciousness.
Amniotic fluid embolism. The mother has developed amniotic fluid embolism. Amniotic fluid embolism, with an incidence rate of only 7 in 100,000. Amniotic fluid embolism, we actually encountered it.
Vice Dean Zhao, you are the most experienced among us. What do you say we should do next?
Our hospital cannot treat this. Arrange for a transfer.
What did you say? If you arrange for a transfer now, it's equivalent to taking her life. Both mother and baby will die. Are you even a doctor?
Then, according to Director Han's brilliant insight, what should I do?
We absolutely cannot give up. Continue with resuscitation.
Han Kinjia, do you know what amniotic fluid embolism means? Once a mother develops amniotic fluid embolism, the mortality rate is as high as 86%. With our current conditions, we simply cannot complete the surgery.
Even so, we cannot give up.
I'm not giving up. I'm talking about transferring her. Only by operating on the mother in a hospital can her safety be maximally guaranteed.
The golden rescue window is only 5 minutes. If you transfer her now, you just don't want the mother to die under your scalpel. You want to escape your responsibility.
Yes, I don't want to bear this responsibility. What about you?
The film was
You want to save her.
translated
You have the
and
confidence to save this
narrated
pregnant
by
woman.
Media.
Director Han, it's better to go with the hospital's decision. Vice Dean Zhao, it's also for the good of our hospital.
You all. You don't deserve to be doctors at all.
Director Han, this surgery, we cannot do it.
Who says we can't? With me here. She will definitely be safe. This surgery, I will perform it.
Lin Feng. To back Han Kinjia up. You're simply unscrupulous. Do you know what amniotic fluid embolism means? It's a death sentence. You want to save her? Who do you think you are? Are you a miracle doctor?
Linfeng. Can you do it?
If you would just keep quiet, I could.
Han Kinjia. Are you crazy? Even I am not confident about this surgery. How can he, a caregiver, perform it?
That's right. I trust him. Given his current skill and his precise grasp of the patient's condition, he is the most capable person I have ever met.
How many doctors have you even met?
He was the first to discover that the pregnant woman's condition was abnormal and told me to prepare the blood bank. If this operating room needs someone to save Mrs. Zhou, then that person must be him.
Director Han, performing surgery is no small matter. It's not just about trust. That can save a patient's life.
Director Han, why don't we listen to Vice Dean Zhao? Hurry and arrange for the pregnant woman to be admitted to the hospital. Maybe there's still a chance.
Do you see, Han Kinjia? My opinion is what everyone expects.
Linfeng, there's no time left. You are the pregnant woman's last hope. Can you do it?
Han Kinjia, just be stubborn then. If you want to take responsibility for medical malpractice, bear it yourself. I don't have time to fool around with you here. You're waiting for this caregiver. If something goes wrong, how will you explain it? Let's go.
Prepare to begin the rescue.
Everyone, cooperate with Linfeng. Linfeng will be the lens surgeon. Others assist.
It's been a minute and a half since the pregnant woman was found to have amniotic fluid embolism. There are only about 3 minutes left of the golden time. It's too late.
Amniotic fluid embolism rescue. How can anyone do this? What? What is amniotic fluid embolism? Yes, what is amniotic fluid embolism? Amniotic fluid embolism means the entire body's blood is contaminated. The pregnant woman's entire blood supply needs to be quickly replaced. That miracle doctor before had one successful case. One surgery lasted 27 hours, using 60,000 milliliters of blood. That's equivalent to the total blood volume of 17 adults. That's terrifying. So, this live broadcast of the amniotic fluid embolism surgery, can it succeed? Let's just watch for now.
Time check.
Beijing time 11:23.
Han Kinjia, First assistant Li Yun, second assistant, Xiao Sun. 3-minute countdown.
Okay.
From now on, this surgery will be led by me.
The golden time is only 5 minutes. Now there's less than 3 minutes of golden time. Lin Feng wants to complete the surgery within 3 minutes. Who does he think he is? A miracle doctor.
Perhaps. He really is a miracle doctor. No, that's wrong. How could a miracle doctor be in a small hospital like ours?
Doctor, how is my wife? What does that have to do with me? No, I didn't give it to you. Where's my wife? Why didn't you save her? The pregnant woman has amniotic fluid embolism. Our hospital is not capable of treating it. Right during the golden treatment time, when we were arranging for transfer, those doctors inside insisted on treating her. I'm afraid your wife is in grave danger. What? Impossible. It was clearly that kind male doctor who came to save my wife first. Tell me, was it you? Did you intentionally harm my wife? Get lost. Explain yourself clearly, otherwise, even if we have to go to jail, we'll still teach you a lesson. You probably don't know, do you? That kind doctor you're talking about isn't a doctor at all. He's just an orderly. He's just a handyman. An orderly? That's right. It was him. That kind doctor you're talking
The
about
film was
is about to kill your wife
translated
with his
and
treatment.
narrated by Media.
I didn't expect that. Kind-faced doctor was actually an orderly. Brother Zhou's wife, who finally got pregnant, was actually killed, taking to lives with her. No, I can't stand this anymore. Brother Zhou, let's go save sister-in-law. Let's go. We can't let him kill my wife. Go. What are you doing? Get out of the way.
Local intravenous anesthesia.
Intravenous anesthesia.
You all, get out of my way. I'm taking my wife away. They're performing surgery inside. If you go in, you'll kill someone. Bullshit. Your vice dean already told me. The one operating on my wife is an orderly. If you don't get out of the way now, I won't be polite. Move.
Ling Feng, it seems someone has broken in outside.
This is a critical moment in the surgery. If they break in now, the surgery will completely fail, won't it?
Pressurized oxygen.
What are you all doing? So impulsive. The pregnant woman is having a difficult labor. She's undergoing emergency treatment.
Emergency treatment. With so many doctors here, you're actually letting an orderly perform the rescue? This isn't a rescue. It's clearly harming someone. That's right, Brother Zhou. Let's hurry and save her. If we're too late, she'll be gone.
You must trust Ling Feng. Ling Feng is very capable. He will definitely save her.
Wiping sweat. Atropine. 1 milligram. 4 posh.
A mere orderly. What does he know about medicine? Don't say I didn't warn you. There's no movement inside now. What? Perhaps your wife has been treated to death by him. Wife. Bastard. Give me back my wife's life.
Hey, what are you doing? Get out of the way.
I didn't hear that wrong, did I? No way. He only took 3 minutes to complete the C-section.
Patient's family.
What? I am. My wife and child.
Mother and child are safe.
That's great.
However, the mother is only temporarily out of danger. She will need to go to the hospital for further surgery.
You just said mother and child are safe.
Yes. Congratulations. It's a boy.
I have a son. Thank you, doctor.
So many of you. What are you all doing gathered here?
We heard the baby was born. We specifically came to see. To see. Right, that's right.
The film was
To see.
translated
They just
and
came to see.
narrated by Media.
Impossible. He's just a small-time orderly. How could he possibly deliver a baby? Maybe your wife was clearly treated to death by him. Shut your mouth. You just cursed my wife and child, and I let it slide. Now you almost made me misunderstand, and wrongly accused my family's benefactor, Brother Wang, Brother Zhao. Deal with him for me. What are you doing? Dr. Lin. Thank you. I'm sorry. Just now, I listened to that old bastard words, and I almost misunderstood you. Please forgive me.
It's alright, I don't mind. You don't need to apologize to me. The one you should apologize to is Dr. Han.
Dr. Han, I'm sorry. I shouldn't have pushed you just now. If you want to hit or scold, come at me. I'm the one who wronged you.
It's alright. It's understandable in a moment of urgency.
Alright. Please wait outside for a moment. We still need to continue the surgery.
Hey, Dr. Lin, Dr. Han. This is all the money I have on me. I'm offering this as an apology to you. Please, I beg you, don't implicate my wife.
What are you doing?
It's alright, we are doctors. Saving lives and healing the injured is our duty. We won't, because of this small matter, refuse to save a patient, alright?
I didn't expect. These two doctors, so young, not only have superb medical skills, but also such noble medical ethics. I'm really not a good person, am I?
The delivery surgery has successfully concluded. Thank you for your hard work, everyone. The pregnant woman's condition is currently stable. Further surgery will be conducted back at the hospital. Arrange the transfer back to the hospital quickly. Also, ensure the pregnant woman stays warm.
Arrange transfer back to the hospital.
Dean Han, this time we're really going to be famous. I live stream Lin Feng's process of saving the pregnant woman. I live stream the entire thing. The popularity is soaring now. The comments below are all saying that Dr. Lin's medical skills are divine.
That's good, that's good. It seems that Xiaolin is about to become our hospital's golden signboard. Sister, I found someone who can cure your eyes.
But, brother, didn't you say that the one who can save my eyes is only divine Dr. Lin? Now divine Dr. Lin is missing. Where are you going to find him?
Trust me. The doctor who can cure your eyes is right here in this hospital. My name is Chen Yang. I am from the second hospital in the neighboring city, the chief surgeon in the emergency department. My specialty is vision restoration surgery. I never expected that this time I would meet you all. As a patient.
I've heard of you. At 17 years old, you were admitted to the top university in the country. At 27 years old, you studied abroad and earned a doctoral degree. Afterwards, you rejected generous offers from abroad and resolutely returned to serve your homeland, advancing the development of ophthalmology in our country by 20 years.
Dr. Chen, to date,
The film was
you have enabled tens of
translated
thousands of
and
patients
narrated
to regain
by
their
M
sight,
Media.
haven't you?
Those are just empty titles. As for me now, I don't know if I'll be able to perform surgeries anymore.
The situation is not optimistic. Besides the ulna, radius, and carpal bones, all suffering varying degrees of damage. The ligaments are also torn. What's more serious is that the nerves in the palm have been severely damaged.
Then Dr. Chen's hand.
The hands are the most complex limbs in the human body. The bones can be healed, and the ligaments can recover. But these nerves. Dr. Chen's career has been completely ruined by this medical dispute.
Dr. Chen's hand. Is there really no way for him to perform surgery again? But there are still so many blind patients waiting for Dr. Chen to save them.
Your career will not end.
It's you, Lin.
Lin Feng, when you're joking, can you please consider the occasion? Dr. Chen's hand has been cut, and his career might very well be cut short. This is not the time for you to boast.
Lin Feng! Although you performed a few surgeries before, the nature of this surgery is completely different from what you've done. You'd better stop talking.
No. I believe in divine Dr. Lin. If it's him, perhaps there really is a way.
What? Dr. Chen. You actually believe Lin Feng? He just shares the same name as the Divine Doctor. He's not the real Divine Doctor.
Dr. Chen, you've just arrived at our hospital, so you might not understand the situation yet. This Lin Feng was just a small nursing assistant before. Let alone being related to the divine doctor. He's not even considered a proper doctor.
Enough. Why are we talking about this now? Our main priority is to save Dr. Chun's hand.
No, Kinjia.
I said enough. Linfeng, do you have any good treatment plans? You can bring it up.
Carry out surgery. Suture every nerve. Rest and recover.
Linfeng, this is what you said about saving Dr. Chen's hand. The treatment plan, surgery, and operation. Suturing nerves. Linfeng, do you think this is a children's game? Do you know what hand nerve suturing surgery means? Across all hospitals nationwide, how many doctors can accomplish it?
Zhao, this nerve suturing surgery. Is it that difficult? Yes, nerve suturing surgery sounds as simple as attaching hair. But in actual practice, it's like using an ear pick to scoop out all the water from the ocean. The difficulty is that terrifying? Human nerves are extremely complex throughout the entire body. There are 100 billion nerve units. Hand nerves number as high as 1 million. If even one is not connected correctly, Dr. Chun's hand still won't be able to perform surgery. The plan Linfeng proposed is feasible, but looking across the entire world, no one can accomplish it. This is also why Director Li is angry. No. There is one person who can accomplish it. Who? Divine Dr. Lin. He previously online performed a surgery. He was in Kyoto, yet he performed a surgery for a patient in San Francisco. A brain tumor removal surgery. Not only was the surgery very successful, but also the patient to this day has not had a relapse. That amazing?
You can't do it. But that doesn't mean I can't.
You!
The film was translated and narrated by M Media.
Vice Dean Zhao, what are you doing here?
I just heard that our hospital had a medical dispute incident. Our emergency room doctor was stabbed in the hand by a patient's family member. As the vice dean, I came to visit.
This is a matter for my emergency department, and your condolences are not needed.
You, Linfeng, I told you before, young people shouldn't be too arrogant. How about now? You're getting your comeuppance, aren't you? Your hands are crippled, and from now on, you won't be able to perform surgery. How are your hands crippled? Who are you?
His name is Chen Yang. He is an ophthalmologist and an ophthalmic surgeon who has restored sight to tens of thousands of blind patients. Ophthalmic surgery expert.
Linfeng, your hand, are you alright? These good-for-nothings couldn't even handle such a small matter. Couldn't even handle such a small matter.
Could it be that you hope something happens to Linfeng?
It's not like that.
Since there's nothing wrong, please go back first. We still need to discuss the plan.
Kinjia, Vice Dean Zhao has extensive clinical experience. Perhaps he can give us some advice. Vice Dean Zhao, it's like this. We are currently discussing the hand nerve suture surgery's feasibility. We don't know if you have any practical suggestions.
Hand nerve suture. Director Lee, are you alright? Looking at the entire hospital, who has the confidence to perform such a surgery? Is it you or you?
I believe Linfeng can successfully perform this surgery.
Han Kinjia, I know you and Linfeng are close. Looking at the entire country, doctors who can perform hand nerve suture surgery are no more than 10. Those who can confidently succeed are probably only divine doctors.
How about this? How about we make a bet?
What are we betting on?
If Linfeng successfully performs this surgery, from now on, you cannot trouble him again.
Okay, if his surgery fails, both of you will resign voluntarily. From now on, you are forbidden from engaging in any profession related to medicine.
Okay.
It's a deal. Let's go.
You trust me so much.
It's not that I can't stand his lawless behavior.
Then you can't.
All right. Prepare for surgery.
After your surgery fails, get out of this hospital. I'll wait for an opportunity to kill you.
Hello, everyone. This is our hospital. From 19 years old, Sister Lan, Lin Feng is going to perform surgery again. This time it's even more incredible. It's a hand nerve suture surgery. What? Quick, prepare the live broadcast stand. Hurry.
Starting now. Hand nerve reattachment surgery. Han Kingya. First assistant, Li Yan. Second assistant, anesthesiologist. Stand by. Nurse Sun, you are responsible for recording patient information, heart and blood pressure, and constantly monitoring.
Yes.
Surgery begins.
Yes.
Right angle clamp.
Hello everyone. This is our hospital's surgery live broadcast room. Currently underway is hand nerve reattachment surgery. The chief surgeon is Dr. Lin from our hospital.
Director Han, pressurized oxygen.
Okay.
The hand nerve is severed, so the patient's hand nerves are severed. Then this is basically over. This doctor looks very young. I feel their medical skills aren't very good.
Maybe he's just a pretty boy seeking attention. The injured person is also a doctor. Everyone, please wish him well. May the surgery be successful.
The injured person is actually a doctor, then his latter half of life. The injured person is actually a doctor, then isn't he finished? This doctor's career is already over.
No matter how the surgery goes, it's a waste of effort. Everyone, please wait patiently. Currently, this surgeon is very skilled. He once successfully rescued a pregnant woman from amniotic fluid embolism, even if he saved her. What about amniotic fluid embolism? Obstetrics and gynecology and neurology are completely different. This doctor, can he really do it or not? What then?
I heard this chief surgeon, it seems he used to be just an orderly.
An orderly by background? Are you kidding? You are saving a doctor. Are you being so irresponsible? You don't understand the situation. Don't talk nonsense. Dr. Chen Yong injured his hand due to a medical dispute. You're not only saving a person, but also saving Dr. Chen's professional future. If you dare to distort the facts again, I will kick you all out of the live stream. The current medical environment, doctors truly suffer.
Medical disputes harm people. Wishing the surgery success. Wishing Dr. Chen a smooth future.
I believe in Dr. Lin, and I believe Chen Yong's hand will definitely recover completely.
Lin Feng, I've always believed in you.
Dr. Lin, how did you tear Chen Yong's wound open? What kind of terrible doctor is this? Is he here to harm people's lives?
Is he perhaps holding a grudge against this doctor and intentionally retaliating? An orderly dares to perform surgery. This hospital is simply lawless. I'm going to report you right now.
Don't disturb Lin Feng. If you keep doing this, get out.
Nurse Sun, glasses.
Lin Feng, don't feel pressured. I believe in your skills.
Director Han, you'd better not believe him. Quickly kick him out and bring in Vice Dean Zhao. Perhaps Chen Yong can still be saved.
Deep radial nerve. Connection completed.
How is that possible? Chen Yong's hand was injured so severely. Deep radial nerve. How is that possible?
It's true. Deep radial nerve has already been reconnected.
Lin Feng, you're amazing.
Don't get distracted.
What nerve? This doctor's surgery, what nerve is this? Was it successful?
It's just reconnecting a nerve. Can this hand be used? That remains to be seen.
To be able to reconnect the radial nerve, this kid has some skills, but the median nerve and the digital nerves are also very important. I don't know if he can succeed. Lin Feng, you have some ability. However, restoring the tendons and the remaining nerves is not a small problem either. What do you need my help with?
I need you to be quiet. Stand by the side and follow my instructions.
Alright, today I'm going to see whether you can actually save Dr. Chen.
Vice Dean, it's been 3 hours. This Lin Feng won't be able to pull off any tricks. A nursing assistant. How can he be compared to you, the Vice Dean? Be mentioned in the same breath? I say, little girl. Lin Feng is just a nursing assistant. This surgery, if I were to perform it, your brother's hand might mostly recover. If Lin Feng performs it, your brother's hand will be crippled. This Lin Feng, although he couldn't cripple his hand, but he brought Han Kinjia and spoke arrogantly, ruining his own future, is also a decent outcome. That's not wrong. Some people, you see, don't choose a good doctor, but chose a useless one instead. Then the consequences, they'll have to bear themselves. Let's go back and drink tea, okay? Brew some good tea.
That doctor, can he really cure my brother? Median nerve and ulnar nerve. Connection completed. The eardrum injury has also been treated. Oh my god, this is incredible. Nerve, finer than a strand of hair. He actually managed to connect it successfully. He can save people from amniotic fluid embolism. He's simply a medical genius.
How is this possible? His hands, even compared to a machine, are faster and steadier. Who exactly is this Lin Feng?
I've already had a nap. This surgery isn't even finished yet. This doctor's energy is too good. The nurses in the operating room feel like they can barely stand.
Don't tell me the surgery failed. Let's stall for time here. Will it work? Quickly.
Lin Feng, are you okay?
I'm fine. If you're tired, then go rest for a bit on the side.
No. I'll stay with you until the end.
It's almost 12 hours, without eating, drinking, or resting. This Lin Feng is indeed worthy of being able to save a pregnant woman with amniotic fluid embolism.
The film
What a
was
master doctor.
translated and narrated
Surgery
by
successful.
M-Media.
Lin Feng. Chen Yong's hand. Oh my god, I'm going to cry. This doctor's hand. It's finally saved. How is this possible? A hand that just underwent surgery can actually move? How is this possible?
Lin Feng, this.
Normal. Although, Chen Yang is still in a coma. But, the tendons and hand nerves have all been successfully connected. The nerve function of the hand has already recovered.
That's great.
This is simply a miracle. Lin Feng, you're amazing. Lin Feng, you're simply my idol. As far as I know, there's only one person in this world who possesses such miraculous surgical skills. Unless he is the divine doctor, could it be that he is? Nerves completely severed, tendons damaged. Who else can make such a hand recover as before?
Only the divine doctor has ever completed such a high-intensity, precise surgery. Divine doctor? I've seen a living divine doctor.
Lin Feng, you?
Lin Feng, are you Divine Dr. Lin? Impossible. How could the Divine Doctor be cooped up in our small hospital, working as a nursing assistant?
Alright. Everyone has worked hard. Let's first take Chen Yang to the intensive care unit.
It's been a long time, and they still haven't come out. Hey! What's wrong? So slow. Chen Yang can't be moved out. I'm afraid he won't wake up.
Dr. Lin. How is my brother?
I told your brother a long time ago to believe the words of a mere nursing assistant. Now look what happened. He even lost his life. I said we should find a gold medal doctor to perform the surgery. Now look what happened. His life is gone. Exactly. This doctor has no diamond drill, so he shouldn't take on porcelain
The
work.
film was
His hand was just
translated
injured,
and
but he actually wanted to
narrated
take
by
his life.
M-Media.
Someone's life.
Don't be sad. Sue the hospital for compensation. Demand compensation.
We want compensation. Compensation.
I don't want compensation. I just want my brother back.
Don't worry. This matter has nothing to do with our hospital. No relationship. Lin Feng is just an orderly. I'll expel him from the hospital right now. And send him to jail.
Send who to jail? You all be careful. Why are you walking so fast? You didn't even wait for us.
I just want to talk to the patient's family first.
Han Kinjia. You're shielding him. Chen Yang. He's probably already dead, isn't he?
You're the one who's dead. You're a doctor. Don't you know that patients need to wake up from anesthesia? What nonsense are you spouting here? I must tell Dean Han.
Waking from anesthesia. Could the surgery be successful? Chen Yang's hand was chopped up like that. How could it possibly recover?
Of course you couldn't. But Lin Feng can do it. It's clear as day on the live stream. Lin Feng just finished the surgery, and Chen Yang's hand can move.
This is impossible. How could it move? Oh my god, it's true. The needle was just pulled out, and his hand can move. This is truly simply divine skill. You even saved someone from amniotic fluid embolism, a disease with a mortality rate of nearly 100%, and you actually managed to save them. Dr. Lin, my wife is giving birth next month. Please, you must be the lead surgeon.
Dr. Lin! Dr. Lin, I beg you to.
Dr. Lin, Dr. Lin, Dr. Lin,
Dr. Lin, please.
Dr. Lin.
Alright, calm down. Everyone, the hospital will arrange it. Let us first talk to the patient's family, alright?
Dr. Lin. Dr. Lin, my brother.
Your brother's surgery went very well. Don't worry, he will definitely recover completely.
You must believe in Linfeng. He will surely be able to save your brother.
Wait a moment. I think there's a problem with Linfeng's surgery. I'll speak after I've confirmed it. Vice Dean, all the nerves in Chen Yong's hand are connected normally now. A surgery of this difficulty. Linfeng really completed it. How is this possible?
Did you see that, everyone? Dr. Lin's surgery was successful.
So good, can do such a complicated surgery. As expected of Dr. Lin. I never thought he actually succeeded. Impossible. How could Linfeng complete such a complex surgery? Could it be he is the one? No. He's just a nursing aide.
Vice Dean Zhao. Linfeng has succeeded. The previous bet. Can we fulfill the promise now?
The surgery was successful. But whether it will affect this doctor's career is still uncertain. Director Han, you're making a conclusion too soon, aren't you?
You're going back on your word.
After he recovers, he can absolutely continue to be a doctor.
The film was
What a nursing aide says
translated
doesn't count.
and narrated by M Media.
I only draw conclusions based on facts.
Vice Dean Zhao, are you going to renege? Vice Dean Zhao, are you planning to deny it to the end? Is that right?
I said, I speak based on facts. He's just a small nursing aide. Is he worth me looking for trouble with?
During this time, Linfeng's abilities are obvious to everyone. His medical skills are far more than just those of a nursing aide.
Performing a few simple surgeries by luck. Do you think that makes him a miracle doctor?
You.
It's alright. What about the patient? We've already saved them. That's what's most important. Vice Dean Zhao, I hope similar incidents don't happen again.
What do you mean?
What do you think I mean? Don't let it happen again. Otherwise, you will definitely regret it.
Are you threatening me? Hey! Dr. Lin. I just watched your live surgery broadcast. Your medical skills are truly super. Dr. Lin. I heard someone has been bullying you. Although I don't have much ability, if someone dares to bully my benefactor, I'll risk my life, and I'll get justice for you. Why should he? Linfeng only performed one surgery. And people are protecting him like this? Hey, you, surnamed Zhao. Your last beating wasn't enough, was it? Fine. Isn't it just a promise? I'll keep my word. From now on, I won't bother you anymore. But you, make sure you never fall into my hands again. Hey, you! Let's go.
Mr. Zhou, thank you for this time.
Dr. Han, please don't say that. Thanks to you all. Our family is safe and sound.
How's the child?
Everything's fine.
Linfeng. The patient's family wants to see you.
Dr. Lin, well, if you have something to do, please go ahead and be busy. I'll go check on the child.
You go first.
Please carry on with your work.
Thank you, Dr. Lin. Thank you for saving my brother. He is a doctor. If his hand were crippled, his latter half of life would be over.
It's nothing. These are all what we should do.
I heard from others. If it weren't for you this time, his hand would have been crippled. I really don't know how to thank you.
What are you doing? Don't do this. Quickly get up. Quickly get up. Don't be like this. Your brother is a doctor. He has saved many people. For us to save him is only right.
Thank you all.
Linfeng. This time. You're impressive.
Your brother's hand has already recovered. You should go back and rest first. Wait until you've adjusted your condition before seeing him, okay?
Let's go. I'll take you to see him.
This time, I should also thank Dr. Lin.
Why are you thanking me?
If it weren't for you being able to complete this surgery, according to the wager, I should have resigned and left the hospital. Thank you, Dr. Lin, for saving my medical career.
You still know. Next time you absolutely cannot be so reckless.
Okay, I believe you.
You go get busy first. I'll go check on Dr. Chen.
Okay.
Is Dr. Lin here?
It's me.
Mr. Lin. You are the divine Dr. Lin, aren't you?
Brother, is Dr. Lin really the divine Dr. Lin?
How does your hand feel?
The divine Dr. Lin actually doesn't want to reveal his identity. He hides his identity. There must be his own reasons. Let's not ask that. The sensation in my hand is clear. It just needs to fully recover. And I believe you.
That's good then. You should rest well.
Thank you, Mr. Lin. If I hadn't met you, my hand would probably have been crippled.
Let's not talk about these things. Fortunately, the outcome is go.
To be able to meet someone like Mr. Lin is my honor. Thank you very much.
Someone like me.
Mr. Lin, as a top clinical expert, and about to receive the Lasker. Even the British Royal Hospital and the chairman of the Global Medical Association have offered you high-paying positions. Why are you staying in this small hospital?
I called myself a divine doctor. Saved everyone.
Lin Feng's mother.
But in the end, I couldn't even save my own mother. Money, power, fame, and fortune are meaningless.
The divine Dr. Lin's past must also be full of regrets. Since Mr. Lin doesn't wish to say more, then I won't ask. But, Mr. Lin, could I trouble you with one more thing?
Please speak freely.
Given my current situation, I'm afraid it will be difficult for me to be discharged from the hospital anytime soon. During this time, could you please help me check on my sister's condition and conduct a consultation?
Yes, I can.
Thank you. I shouldn't be troubling you. But my sister's situation is special. I truly feel overwhelmed. I really must thank you.
You're welcome. This is my job. You should rest well.
Superb medical skills, profound understanding of righteousness. This is truly a deserving divine doctor. An unparalleled national talent.
Lin Feng, what's wrong?
Nothing. Just thinking about some past
The film
events.
was translated and narrated by M Media.
Lin Feng, I want to ask you a question. You are divine Dr. Lin, aren't you?
How are you so sure I'm him?
Although Jiaoshen's character isn't good, his medical skills are quite decent. Even he couldn't get Zhenyong back onto the operating table. But you did it. Besides this explanation, I really have no other reason.
There are many good doctors in this world.
I'm very familiar with divine Dr. Lin's signature. The signature you gave Jaelan. It's simply too similar to divine Dr. Lin's.
You also said it's just similar. I have something else to do. I'll be leaving now.
Hey, I'll treat you to a meal. Alright, go on then.
Dr. Lin, we can begin.
First, let's briefly introduce the patient's condition.
This patient's name is Lejang. Male, 73 years old, an early-stage Alzheimer's patient. His current symptoms are memory decline and memory loss.
Everyone. The goal of this consultation is to treat Alzheimer's disease. Liun, could you briefly tell us about your family situation?
What? This?
The film was
And our treatment plan.
And
What is the
narrated
connection?
by M Media.
Of course there is.
Hello everyone. My name is Lian. A child born in the mountains. I grew up in the mountains since childhood. When I was 6 years old, my mother passed away due to illness. leaving me and my younger sister. Only our father was left, raising the two of us alone. My father worked hard, his whole life. His greatest wish was for my sister and me to leave the mountains. After graduation, I entered the hospital and became a doctor as I wished. Originally, it was time for him to enjoy life. But I didn't expect that.
I have a somewhat immature idea.
As long as there's a glimmer of hope, I'm willing to give it a try.
Linfeng, you have a plan so quickly. What kind of method?
We need to put on a play.
A play?
Yes. I need you to help me find two people. One is a little boy around 10 years old. And another is a teenager around 18 years old.
Okay.
Maybe it really can work. Little one, remember clearly what I'm about to say, okay?
Okay.
From now on, your name is Leon. You are a child who came out of the mountains. Remember that.
Yes.
From now on, your name is also Leon. You are a university student who just got into medical university. Your grades are excellent.
The film
Okay.
was translated
Got it clearly.
And narrated
Got it
by
clearly.
Media.
Okay,
I didn't see that wrong, did I? Dr. Lin wants to treat Alzheimer's disease. I think he's dreaming. This is Dr. Linfeng. He's very skilled. Don't talk nonsense if you don't understand. Who exactly is it that doesn't understand? But Alzheimer's disease is an irreversible degenerative brain disease. It's an irreversible degenerative brain disease that is fundamentally untreatable. That's right. I also heard even the legendary divine doctor couldn't cure it. I think Dr. Lin is going to fail this time.
Everyone stop arguing. Since Dr. Lin has proposed a treatment plan, there must be a chance.
Linfeng, what method do you have exactly?
Exactly. What exactly are you trying to do?
memory resculpting. Have you clearly remember everything I said?
Yes.
Go.
Trust Linfeng. He will definitely succeed.
Is he crazy? Memory ray sculpting? It sounds so intimidating. I think it might actually work.
Dad, I'm home from school.
Son, you're back. Are you hungry?
Dad, I'm not hungry. Let me tell you some good news. I scored a perfect 100 again on this exam. I even used my saved pocket money to buy you a new pair of shoes.
Hey! Dad has shoes to wear. Do I still need you to buy them for me? From now on, spend your money on yourself.
Hey! When I was little, my father was also very good to me. But the first was rebellious.
That's right. I was too playful back then. Every day I thought about how to go against my father. Son, where are you going?
I'm going to study hard. I want to get into university.
Get into university.
10 years ago.
Dad! Dad! Dad!
What's happened? Why did you come here? It's dirty here.
Dad, look what this is. I got into medical university.
Son, that's wonderful. Oh my god. My son got into university. Dad. 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 Look what this is. This is an admission letter. An admission letter? A university student. My Lee family finally has a university student. Yes, Dad. Once I get into university, once I graduate from university and earn money, I'll let you enjoy a good life. Okay. Your old man will just wait to enjoy life. When I was in school, I didn't study at all, and I always went against my dad. Now that I think about it, it was really bad. When I was in university, I was busy dating every day. I never thought about how my dad was. Dad, I went to school to look for a job. Wait for me to come back and support you, okay? Work. Work is good. After going to university, you could find a good job. Okay.
Leon.
Dad! Dad! I found a job. Now, I'm a doctor who treats patients and saves lives.
My son has a job.
Dad! Dad! Didn't you always say that we should leave the mountains? I did it.
My dad passed away over 10 years ago. Now, I don't even have the chance to call him anymore. I wanted to care for father, but he couldn't wait any longer. Cherish the people in front of you. Son. Son. Is that you?
Dad! You remember me? It's me.
Dad, where's Mother?
Look, I scored 100 points.
Dad! I got in. I got into medical university. I was admitted. Dad! Look! See what I received. A silk banner given to me by a patient.
The First People's Hospital, Leon.
Dad! Dad!
Son, you've grown so big now. You even have white hair. You must have had a tough time these past years.
Dad, it's not tough. Dad!
Son. My son.
Dr. Lee's father. He actually remembered.
How is that possible? This patient's Alzheimer's syndrome. It was actually cured. Dr. Lin is so amazing. I think Dr. Lin is even more amazing than Dr. Lin the divine healer. His medical skills have definitely surpassed those of a divine healer.
Today we witnessed a miracle. An Alzheimer's patient regained their own memories.
Linfeng, that's great. Your plan succeeded. Why did you come to the rooftop alone? Are you afraid of others praising you?
No. I'm getting some air.
Are you thinking of Auntie again?
You say? If my mother had been in the early stages of her illness, and I had my current medical skills, the ending of the story, would it be different?
Everyone's life has regrets. We all have to carry our regrets and keep moving forward.
Kingya. Thank you.
Dr. Lin. Dr.
Film
Lin.
was translated
Why
and
are you all here?
narrated by M.
Everyone's
Media.
looking for you.
It's too stuffy inside. Came out for some fresh air.
Yes, for some fresh air.
Your face is so red. You really do need some fresh air.
What's wrong?
I'm looking for him. Linfeng. Thank you.
Leon. You're welcome. This is my duty.
It's different. Before, I targeted you everywhere. And again, I denied your professional ability. Thank you for saving my father.
Then it should be me. Who thanks you? You helped me fulfill a wish.
No matter what. You helped me save my father. Given that you helped me, Kinjia, I won't argue with you anymore.
You can't win against me anyway.
Lin. So you can joke. I thought you couldn't smile.
I'm not anyone's possession. What's this talk about giving way?
Lin Feng. Junior sister. I'll leave it to you this time.
I know.
All right. Let's not talk about this anymore. Divine Dr. Lin. To thank you for saving my father, I'll treat you to a big meal.
But you still haven't said what you mean. Answer quickly.
It means nothing. He's
jealous. Mind your own business when it comes to men's affairs.
Dr. Lin. Please save my sister. Siki. Did you hurt yourself when you fell?
Brother, I'm fine.
Why did you run out by yourself? Didn't I tell you to stay put in your room?
I was worried about you. I was afraid someone would hurt you again, brother.
It's all my fault, brother. Not only did I not cure your illness, but I also made you worry about me in return.
Brother, don't talk about yourself like that. My eyes can't see. I have a brother who can take care of me. And that's enough.
Dr. Chen, let's go inside first.
Okay. Come, Siki.
Slow down, slow down. Dr. Chen, your sister's eyes.
My sister has suffered from an eye condition since childhood. When she was little, she could still see. But as she grew older, her eyesight became worse and worse. You don't know how much my sister used to love to draw. She loved to draw swans playing by the lake, and to draw the cloud-shrouded, mist-entwined mountain forests. She told me she wanted to draw all the beautiful scenery in the world and capture it all. But on her 18th birthday, she told me,
Siki, may I ask about your eye condition?
Okay.
When did it first start for you? What were the initial symptoms?
When I was around my teens, I suddenly felt my vision wasn't as clear as before. I thought it was because I hadn't rested well. Later, this blurry sensation became more frequent. Until recently, I completely lost my sight.
to be honest with you, for years, I have specialized in ophthalmology. The purpose was to find a treatment method that could restore my sister's vision.
Siki, come. Here. Have you had a detailed examination before?
Yes, I have. But her condition is quite complex.
The corneal opacity is one of the main factors leading to her blindness. It requires osteoodontokeratoprosthesis surgery to help her regain her sight.
However, this surgery is extremely difficult. But I have also researched this surgery. Previously, my teacher cooperated with me to complete this surgery. But 2 years ago, my teacher passed away. And now that my hand is injured, I am even less able to perform this surgery. If someone can now complete this surgery alone, Dr. Lin, it would probably only be you.
First, admit her for a re-examination.
Okay.
Zhao Ocean's office.
This Linfeng, he really doesn't want to be idle for a single day. Dental nerve to optic nerve transplant surgery.
Zhao Ocean's assistant.
What I boast.
Vice Dean. Linfeng's medical skills are quite good. He has successfully treated some difficult and complicated diseases before.
That was just luck.
Vice Dean, what should we do now?
Doesn't he want to challenge performing nerve transplant surgery? Let him do it. I'd like to see if the surgery fails, if he still has the face to remain in the hospital.
Vice Dean, aren't we risking the patient's life?
The
He's
film was
performing the surgery.
translated and narrated
He's the one
by
taking the
M
risk.
Media.
What does that have to do with me? You agree, right?
Don't worry, we've already done the examinations. Once there are no issues, we'll proceed with the surgery.
That's great. Sister, now there's finally hope. To cure your eyes.
Your surgery for tomorrow has been postponed.
Why? The surgery was all prepared. You're just postponing it just like that.
The operating room has other important surgeries scheduled. The nerve transplant surgery will be pushed back.
This must be J-Ocean deliberately making things difficult.
He really hasn't given up his malicious intentions.
No, we can't delay. Every day of delay makes her chances of recovering vision more slim. I'll go reason with him.
I decide the hospital's surgery schedule. There's nothing to discuss. Your patient is a patient. But aren't other patients also patients?
You're deliberately looking for trouble, aren't you? Lin Feng's surgical plan has been verified. He can perform the surgery at any time. You know that.
If I say it can't be done, then it can't be done. What do you want? Here, I am the law.
Brother, is something wrong? Will I still be able to see?
Don't worry, little sister. Your brother is here.
That's right. We will definitely proceed with the surgery as planned. We will definitely also let you regain your sight. Jiaoshen is the vice dean. According to the rules and regulations, he has the authority to stop our surgery. Even my dad can't easily interfere. Now, the only thing we need to consider is transferring hospitals.
But this surgery, regarding the surgical environment and surgical equipment, the requirements are very high. Besides our hospital, in a short time, if you want to find a second operating room of the same level, it would be too difficult.
You all talk first.
Perhaps we still have another option.
Someone is stopping me from performing the surgery.
Lin Feng, you don't have a medical license. How dare you perform surgery in the hospital? This is a legal practice of medicine. J-Ocean, what do you want to do now?
Lin Feng's clinical surgical ability is obvious to everyone. He doesn't know, compared to those with medical licenses, is many times stronger. Therefore, he is qualified to perform this surgery.
I think you are deliberately making things difficult, Dr. Lin.
Ability is ability. Qualification is qualification. If no one has a medical license to perform surgery, then what are hospital rules and regulations for? Security, arrest Lin Feng for me.
I'd like to see with me here. Who dares to lay a finger on Lin Feng?
Exactly. If anyone dares to stop today, Dr. Lin from performing the surgery, they'll have to step over my dead body. Why don't you to make a move then? Are you not even listening to me now? Be careful, or I'll fire all of you. I'd like to see who dares. Come on, those who aren't afraid of death, come and try me. Shenyang, your hand is already crippled. You can't even protect yourself. And you still want to protect others?
Xiaoshen, I advise you to leave here immediately.
Lin Feng. Look at the situation now. You still want to perform surgery? I'm telling you. Not only will you not be able to perform the surgery today, but you won't even be able to protect yourself.
What do you want to do?
As the dean of the hospital, of course, I must stop unlicensed medical practice. As for you, as the hospital's medical director, not only do you not help the hospital, that's fine. You even stop me. You're harboring a criminal.
Jiaoshen, my dad is the dean. This hospital is not yours to make decisions for.
Dean, my foot. He's already unconscious. In this hospital, my authority is supreme.
You.
Go stand aside. This doesn't concern you, J-Ocean. Now only Dr. Lin can restore my sister's sight. If you today dare to lay a finger on him, I will fight you to the death, even if it kills me. Chen Yong, I advise you to stand aside. I'll perform the surgery on your sister shortly. Otherwise, I won't spare you. No. Now, only Lin Feng can save my sister. You have no idea who he is. He is. I'm telling you. Even if Divine Doctor comes today, he won't stop me. I'm telling you, Lin Feng. I know you have some talent. But you're blocking my way. Do you understand? You're courting death. Stop. Jaeoshin, what do you think you're doing? Elder Song, why are you here?
If I hadn't come,
The film was translated.
were you about to lay
and
hands on Dr. Lin?
narrated by M Media.
Elder Song, Lin Feng is practicing medicine without a license. I am helping the hospital deal with the matter of unlicensed medical practice. Lin Feng's medical skills are evident to all of us. You want to deal with Lin Feng? Who do you think you are?
Dr. Lin saved my granddaughter. He is a benefactor to my Song family. You dare to touch him? Do you still have any respect for my Song family? Keep it in mind.
Dr. Lin, please rest assured. With us here, no one can touch you today.
Dr. Lin, this old man will be counting on you in the future. From now on, whoever dares to oppose you is trying to take Song Zheng's life.
Elder Song, you exaggerate. How would we dare to take your life? This is all a misunderstanding. It's all a misunderstanding.
Jiaoshen, you are truly shameless. We've all seen what you've done.
Vice Dean Zhao, it's come to this, and you're still distorting the truth. Hey, I say, what nonsense are you talking about? You can't just because you usually have a problem with me. Accuse me now.
Dr. Lin, how do you think we should handle this?
Expel him from the hospital. Blacklist him from the industry.
Understood. Choshin, do you have anything else to say?
No, they really are slandering me. They're slandering me. Jaeoshin, how much longer will you keep arguing? Han Sangkwon, I say, how are you awake? Weren't I drugged by you? Fortunately, the nurse's examination was thorough. Found the drug was abnormal. That's how I escaped disaster. You drugged me, causing me to fall unconscious. And even plotted against Lin Feng. From now on, you are fired.
Choshin, your medical ethics are corrupt, full of lies. And you even tried to harm Dr. Lin. What's more, what you'll face are the charges against you from the court. I hope you know what's best for yourself. Sorry to have startled you, Dr. Lin.
Thank you.
Dr. Lin. Then my sister?
Don't worry. Otherwise, you two should head back first. The surgery is about to begin.
Okay.
Are you alright?
You already knew Jiaoshen was coming to cause trouble. So you called Elder Song in advance, and CEO Zhou. Right.
If Xiaoshan continued to stay at the hospital, it would affect your position as dean.
You did it too. Help me remove the hospital's cancer. So,
Alright, the surgery is about to begin. Let's go.
he actually, for my sake, was willing to use external forces. Okay.
Corneal scissors.
Isn't that Dr. Lin? Isn't that Dr. Lin? What surgery is he performing?
It seems to be osteoadenokeratoprothesis.
The film was
My
translated.
heavens, I heard that.
and
There are only a
narrated
few
by
people in the
M
entire
Media.
world who can perform this surgery.
Moreover, this surgery requires multidisciplinary collaboration. Only the divine doctor in the world is capable of independently completing this surgery.
Forceps. Secure the patient's mandible. I'm about to start extracting the dental nerve. Prepare the osteodontokeratoprosthesis composite.
This is the osteoadenokeratosis surgery's most difficult step.
It's definitely a show. This is impossible to succeed.
beginning the transplant.
Success. Success. Only the Divine Doctor can complete this surgery. Dr. Lin is indeed the Divine Doctor. Divine Doctor. Divine Doctor, please accept my humble bow.
It hasn't truly succeeded yet. It's not impossible that Lin Feng is putting on a show.
There are only a dozen or so people globally who can collaboratively complete this surgery. The only one who can independently complete this surgery is the Divine Doctor. Lin Feng is actually the Divine Doctor.
For my granddaughter, to have Divine Dr. Lin perform surgery on her is truly a blessing from heaven for her.
So the legendary Divine Doctor is actually Dr. Lin. Look, look. Thank you. Thank you, Divine Doctor.
Prepare for bandaging. After the bandaging is complete, send the patient back to the monitoring ward.
It's confirmed. He truly is a Divine Doctor. No wonder Dr. Lin could save her. Amniotic fluid embolism and cure Alzheimer's. Only a Divine Doctor could achieve this level, right?
Indeed, Lin Feng truly is a Divine Doctor.
How do you feel, little sister?
Brother, I can see.
That's right. You can see.
Well done, Divine Dr. Lin. You hit it well. I was the last one to know.
You never asked me.
I never thought the Divine Doctor was right beside us. It seems I was short-sighted.
To be able to meet Divine Dr. Lin. This is our great fortune.
Lin Feng, I knew from the start you weren't simple. So you're a Divine Doctor.
I hope we can cooperate often in the future.
Then I look forward to your guidance. Dr. Han.
Brother, come a little closer. Dr. Lin, smile.